The Allegheny County Community Violence Reduction Initiative, CVRI communities in Allegheny County have worked hard to reduce violence in their public spaces. But prior to this initiative, levels of investment in community violence reduction efforts had remained low. County communities have made remarkable progress, but have not always been able to continue moving forward because the implementation of evidence-informed approaches has been limited, particularly outside the city of Pittsburgh. In cases where evidence-informed approaches have been adopted, maintaining model fidelity has been challenging. Grants to pay for community-led programs are often short-term and not sustained. There is a lack of coordination to bring partners together to share information and problem solve at both a hyper-local level and county level. DHS will direct approximately $50 million over 5 years towards the Community Violence Reduction Initiative, CVRI, a public health approach to community violence reduction, funding various coordination and violence intervention and prevention activities in communities with high rates of fatal and non-fatal shootings. DHS is funding these strategies across highly impacted communities in Allegheny County, i.e. countywide strategies, and within highly impacted communities in Allegheny County, i.e. hyperlocal strategies. The CVRI's overarching vision is a focused, coordinated, data-driven, sustainable community violence reduction ecosystem that contributes to a reduction of community violence in highly impacted communities. At the core of Allegheny County CVRI is evidence-based and evidence-informed community violence intervention and prevention programs. Intervention programs engage highly impacted individuals, the small group of people who are actively engaged in community violence and/or most at risk of victimization from community violence. These programs focus their efforts on the small population driving community violence and address imminent safety and health needs, working to reduce the likelihood of gun violence victimization and/or perpetration among this population. A key intervention program being funded by the CVRI is an Allegheny County adaptation of the Rapid Employment and Development Initiative, READY, a 12-month program based out of Chicago, Illinois. This program was adapted for Allegheny County and formally titled the Achieving Change Through Transitional Employment, ACTS program. Achieving Change Through Transitional Employment, ACTS, builds on the Ready Chicago program model, integrating outreach activities, a curriculum-based cognitive behavioral intervention, and a workforce development component to create pathways to trauma healing, economic opportunity, and safety among individuals most likely to experience gun violence in communities disproportionately impacted by gun violence. The ultimate goal of ACTS is to effectively engage highest-risk individuals and provide them with services that reduce their risk of serious violence involvement. This is accomplished by leveraging credible messengers to identify, engage, and build trust with potential participants, incentivizing participation with stipends, the offer of a low-barrier job, and access to career training, helping participants overcome stability barriers, and delivering cognitive behavioral intervention to promote individual behavior change.